Today we are going to see the TNM staging of urinary bladder cancer. Basically we are focusing on the T staging. So TIS means carcinoma in situ. But in this case carcinoma in situ has got a bad prognosis because there will be associated invasive carcinoma which we usually miss in the diagnosis. Then TA means it is again non-invasive papillary tumor. So here you can see this is the carcinoma in situ, not invading. TA is also not invading, but this is a finger-like projection, a papillary tumor which is not invading. The remaining are the invading ones. The T1 invades the lamina propria, T2 invades the muscle, T3 invades the perivesical fat, and T4 means adjacent organs. The end staging is basically N0 or N plus, means N plus can be either N1, 2 or 3, okay. But for treatment purpose, we just want to know N plus, whether the node is involved or not. Similarly, M0, M1, M plus, that is metastasis is there. For the treatment purpose, we will divide it into three categories. One is the non-muscle invading, then muscle invading, then locally advanced and metastatic. So, non-muscle invading includes the carcinoma in situ, TA and T1. Okay, T1 is basically lamina propria only invading, not the muscle layer. So, for these three conditions, we have to do TURBT. So, what is TURBT? Transurethral resection of bladder tumor. Okay, that we will do. Then the pathologist will tell us whether it is TA or TIS or T1. If it is TA, we can give intravesical injection of mitomycin C. If it is TIS or T1, we can give intravesical BCG injection. So this is given like weekly, every weekly for 6 weeks. After that, every 3 weekly for about 6 months to 3 years. Okay. And if there is no response, you can do radical cystectomy. The next one is muscle invading, that is T2. So here we will do neoadjuvant chemotherapy followed by surgery. Surgery here is again radical cystectomy, where we will remove the entire bladder, distal ureter and the pelvic lymph nodes also. And the chemotherapy is either gemcitabine plus cisplatin or DDMVAC, that is dose dense methotrexate, vinblastine, adriamycin and cisplatin. If the patient is not fit for surgery, with the chemo you will add radiation. So you have to do chemo radiation. And in locally advanced, that is T3, T4 and N plus, here we can give again chemotherapy followed by surgery or chemo radiation. So basically both are same only. Then metastatic disease, you have chemotherapy, either single monotherapy or a combination therapy. So that's about the TNM and treatment of urinary bladder cancer. Thank you.